Our first session today is on portfolio careers in the NHS, and we're lucky to be joined by Henrietta and Mbeah-Bankas. Henrietta is a University of Mental Health nurse and head of digital literacy at HDE. Before I pass over to her, just some quick ground rules. You can message in the chat function on the right-hand side. If you choose session, that means that they'll all go straight here, and I'll pass them on to Henrietta. You can also send messages directly. And if there are any polls put up, they'll be in the middle tab on the right-hand side. So I'll pass it over to Henrietta now.
Thanks, Alex. Welcome, everyone. So as you see, the title says a career in nursing, but actually it would be applicable to anybody certainly wanting a health career within the NHS or otherwise. So as Alex said, I'm currently the head of blended learning and digital literacy at Health Education England, and also an NHS clinical entrepreneur. Now, what is the head of blended learning and digital literacy doing? So basically, blended learning is obviously a lot of people would have been engaged with learning that uses blended learning approaches. But certainly for Health Education England, this is an area that we are currently really investing in to think about how we train our healthcare professionals. So nursing is an area that we are extremely short of practitioners. So the government really has mandated Health Education England to think about how we can use different approaches, to attract a different group of people. So certainly, if we look at the traditional ways that we train our healthcare professional, not everybody is able to access that because they might have other responsibilities. There might be issues around funding. And so we're using basically the blended learning, which obviously has flexibility in there to be able to do that. Now, my role as digital literacy, the lead of digital literacy for Health Education England, is very much around the work that we are doing to support the 3.1 million health and social care staff to be able to develop digital capabilities that allows them to practice effectively within the health and care settings. So 2 exciting jobs, but still registered as a mental health nurse. And even though I'm not practicing at the moment and haven't done since last June, something that I always hold in mind, and where possible, we'll try and get back into practice. And obviously the NHS Clinical Entrepreneur Program is one that, you know, has opportunities for clinicians who have innovative ideas that want to establish it either in support of, you know, resolving everyday problems within the NHS, but more importantly, you set yourself up as an SME, small to medium enterprise. So for my entrepreneurial program, I am developing an ethno-culturally sensitive mental health screening tool to really address the mental health needs of people from Black, Asian, and minority ethnic groups who mental health is not a language that comes naturally to them. So it's a question of whether we're able to use digital as a means of engaging, you know, people from those communities, and obviously disrupt the AI market where the data that are used to train the algorithms doesn't really take into account people from diverse groups. So big, long introduction, but that's me. Lots going on as always. So where and how do you start? I mean, if you go on the NHS Health Careers website, it will tell you there are over 350 careers in the NHS. Now, 350 seems a lot, but for me, certainly, and I'm sure for you on this call, it's about the health professions. So if we look at the health professions, whilst there are over 350 careers, not all of them are clinical careers. I mean, there are careers in, obviously, for porters, for estate staff, for all sorts of people within the NHS. But when we talk about health professions, certainly from health education perspective, we're looking at 7 main professions. And under these professions, there are significant amount of other areas to go into. So we've got the allied health professions, which is, there are 14 of those professions. Obviously, there's dentistry, there's healthcare science, medicine, nursing and midwifery, pharmacy, and talking therapies. So these are the 7 main clinical health professions that we have got within the NHS. And I think depending on who you are and what you are in terms of your skills, your capabilities, your interests, sometimes it is really difficult to decide which of these careers to follow. And if you did go into one, for example, medicine, it is very much what opportunities has medicine got for me in various areas. So for me, whatever profession you choose, you always start with the end in mind. And you will be thinking, how do I know what the end is? So we all have, dreams, careers, goals. And I think knowing that actually starting an NHS career, basically, whatever time you start, you will be working for at least over 30 years, unless obviously you win the lotto or you come into some money. It is a very long career. So it's starting with the end in mind, thinking, you know what, I am going to be doing this work, or I will be in the career for the next 30 or so years. So if you think about it from that perspective, it is very much around how do I make that the next 30 years enjoyable for myself, worthwhile, but equally be effective at what I am doing. So for me, it's always a long game. It is about what is the end for me, and thinking about it in that respect is very helpful. So the nursing career, I mean, like everything in the NHS, sometimes it is really difficult to map things out very clearly. And whilst there are certain careers that have a clear pathway. So if I take medicine, you do your 5 years, you come in as an F1, you go through you become an F2, you have your CT training, and then your ST. It is almost mapped out. So at each point, the next stage for you, obviously which specialty to go in, and then you're able to stay in there. Nursing is not like that. So whilst this picture is very beautiful and almost outlines the career in a linear way, I think certainly for lots of people, and for me in particular, it hasn't been a linear career. So if I take the picture we are seeing, obviously came in, trained as a mental health nurse. So in nursing, there are 4 areas that you could go into: adult, child, mental health, and learning disability. So I trained as a mental health nurse. My first post is a staff nurse. But as a staff nurse, I mean, I was one of those people that, just coming to doing my day job was never enough. So whilst I was doing clinical practice, I was also looking at education as well. So I started off my career as a staff nurse, having completed a diploma in nursing. Thought, I have itchy feet here, getting a bit excited. Went into education, started to do a top-up degree, and managed to get some funding to do it as a top-up within a year. So it was a scholarship, really. And so did my degree. As part of my degree, did some research, got more and more interested in research. And then I thought, where do I go with this? So as a staff nurse, there's always, various training programs, leadership training programs. So there was something called the leadership training for nurses. Did that program, which meant I became a senior staff nurse with interest in developing expertise in clinical practice, in education, in research, and in leadership as well. So straight away for me, it then became not so much of a linear progression, as in my clinical practice, become a clinical nurse specialist, then move into advanced nurse practitioner, and then become a consultant nurse. It was never like that for me. So I did all of these areas at the same time. So lots of crossing overs in terms of what I did. So being a staff nurse on an acute ward, my biggest area of interest was parental mental health and the impact on children, or subsequently how we intervene as practitioners to be able to support the family rather than the individual. So did lots of work in that area, even though some of it wasn't my day job, including sometimes applying for external funding to implement findings from a study I've done or a piece of quality improvement project. So in effect, what I'm saying is I started off as a staff nurse and now working in an arm's length body, doing lots of things, which is not directly related to mental health, but it's related to supporting the workforce within NHS. So from my staff nurse post, became a senior staff nurse, worked in community mental health settings, and then got to the point where I felt quite stuck, really. It was very much, I didn't know what to do. My senior colleagues didn't know what to do with me. So it was one of those crossroads where I thought, oh, where do I go with this? And thankfully, for the first time in my career, instead of looking for a job using the job description, which a lot of the time I thought, oh, I couldn't possibly do this job, I looked at the person's specification. And this time, the job that I was going for was the Darcy Fellowship. I don't know if any of you know about it, but the Darcy Fellowship is really developing clinicians as leaders and managers to be able to not just, clinicians are excellent at knowing what their patients want and how to meet their needs. But what Lord Darcy identified was actually, if we can get clinicians to understand how you manage things, or whilst previously we had hospital managers that did all the management, didn't quite understand the clinical need, and you had clinicians who understood clinical needs, but not quite how you managed, the money and the policies and everything else. Why can't we train our clinicians to have both? So anyway, applied for that, and that got me out of practice. And to be honest, that's I always say that saved my career within the NHS, because what that did was open new opportunities for me, allow me to be able to use not just my clinical skills, but to be able to use my education skills, research and development, leadership skills, because I was in Health Education England. And Health Education England's business is all about, getting the right workforce in the right place with the right attitude, who are, skilled and proficient. So once I came out of that, I was able to develop not just that, but my leadership skills and other things. So as I have described, now nursing careers, like everything else, medicine, dentistry, like everything else, is changing. And in the 21st century, it isn't very much around jobs for life, which is what we have been used to over the years, that you got a job, you got promoted to the next level, and it was either you went through a management route, you went through an academic route. It was almost a pathway that everybody had to follow, or a job for life. It's no longer the case, certainly not in nursing, not in any of the other 7 professions that I highlighted earlier. So what are we looking at now? We're looking at, careers, having clinical careers with fellowships alongside, with some scholarship programs alongside. Obviously, we've got the entrepreneurial program as well, which, if you look at the evidence coming out of that, has really supported to either bring people back into practice or to be able to actually keep people in practice. There's obviously public health with some consultancy element to it. And then global health. So again, as you develop your expertise, certainly within Health Education England and with our other arm's length bodies, there is a whole big global engagement program. And there are times that your skills can be called on to support some of the work that's happening globally. So again, it just opens up another opportunity that I think a lot of the time people aren't aware exists. And then there is the good old project management. So again, similar to a lot of things, people sometimes will question me, why did you even get a project management qualification? And I have always said, you know what, sometimes it's excellent to be able to do something. But fundamentally, if you want people to take you seriously or give you a job where things are a requirement, you need to get that paper that supports your ability to do it. So I realized that whilst, I had already completed quite a number of projects using quality improvement methodologies and other methodologies, I didn't actually have a qualification to support me being able to tell others. And it is a requirement when you're applying for certain level roles. So I got a project management qualification. And then we are in an era where digital is here. Digital is here to stay. And the evidence is telling us that actually healthcare is one of the areas that will have significant digital, technical, digital skills needs in the next 5 years and in the long term. So there are a couple of pieces of work that's been completed. So McKinsey did some work and published it in 2018. And that work really looked at 5 industries. So you had banking, insurance, mining, retail, and health. And health was 5 times more likely to need digital skills than the other 4 industries. Of course, if anybody knows about the Topo review, which again, I had the real pleasure of being the project lead on that piece of work, which really looked at what technology are coming in the next 5 to up to the next 20 years, and implications for how we select healthcare professionals for training, what that meant for curricular development, and what that meant for the changes in roles. That piece of work also significantly highlighted the digital needs, but more importantly, the fact that we need to develop a digitally ready workforce. That just means that we have got lots more opportunities now in terms of our careers in nursing, medicine, dentistry, any of the 7 healthcare professions, and widely in the use of digital. What it has also meant is we have got new emerging roles. So some of us, I mean, I have been qualified, 17 years now, and I have seen, a real change in the way that we look at professions. And I think we will see even more significant changes as we go forward. So it would be, it will not be a talk at this point without mentioning COVID-19. Obviously, with that, we've had lots of our young people now having to learn from home, using screens, developing digital skills. That is something that the government is really investing in, which means, there's now GCSE computer science, it's in A levels. So fundamentally, there are emerging new roles. And this is why I'm saying it is a long game, and it's about keeping an eye out for what's not even here now, because it is coming. And then obviously there is you can always have a career, an academic career alongside things or on its own. So for me, this is really, I like this pictorial representation of what my career has pretty much been like, and I know for some others as well. There is never a clear route or a road to getting to where you need to get to. It really is about, you can come in from a number of, entry points, but what we must always keep in mind is what the goals are for us in terms of the long term, because alongside you actually seeking out opportunities, sometimes people will seek you out. And I think for me, what has been important throughout my career is being clear about what I want to do and where I want to go with things. So there are times that I have turned down offers, not because, I am not grateful for it, or not because I think it won't add value to what I'm doing, but it is because in my long-term planning or goals, it doesn't quite fit. There are other things that sometimes do not fit, which I will accept, but I will accept it for a number of other reasons. So I will, in subsequent slides, I will talk a bit more about that. But what I also find interesting on this slide is there are a few coinciding points in terms of the journeys we are taking. And even though nobody's standing on those, I think for me, I have stood on a few of these coinciding points. So there are times that, or actually most of the time, I've never stood on one path in terms of what I'm doing in my career. A lot more of the time, I am standing on one of these coinciding points. So as I started earlier on, I currently have three roles, so 2 day jobs, and doing the clinical entrepreneurial program, which is not a day job, but it's a job in itself. So it is very much around you thinking about what you want, how to manage it, and which path you take to get you there. So how do we make it happen? I mean, I think first of all, I cannot say enough that whilst, sometimes people will help make it happen, you are the person that can really make anything happen for you. I cannot stress that enough. A lot of it has to come from you. And where do you start in terms of making it happen? Obviously, like everything else, you need the hard skills. There is no point saying, I want to be a dentist when you are not going into training dentistry training. So it sounds quite, obvious, but I think the hard skills are important. So how do we ensure that we've got the hard skills that we need in terms of the training, the competencies, and the attitude, the competencies to be able to do what we need to do? As one of my senior colleagues a while back rightly highlighted, your patients care about what you know, and it's about the hard skills. You want to instill confidence in the people you're caring for, but more importantly, you want to be able to provide safe care. So the hard skills are important. Now, the softer skills as well, gosh, yes, they want to know that you care. And we all come into our healthcare professions with the fundamental principle that we want to make a difference. We want to save lives, and we want to make a change to people that are distressed or people that are vulnerable. And I think the softer skills, the attitudes, the way we communicate with people, those softer skills are as important as those hard skills. As I've highlighted earlier, it's about having some clear goals. So sometimes people do a year planning, sometimes people do 5-year planning. It is important to have those things in mind, because what that helps you to do sometimes is to be able to think about or work your way back to what will help you achieve those. I do some mentoring, and I sometimes see people almost self-sabotaging, thinking, oh, I couldn't get there. And you ask them why, and there isn't a clear reason why they couldn't get there. It's just, people just sometimes worried or feeling slightly, some people would say imposter syndrome. Oh, I am only a woman. I am only, this person, and I couldn't possibly achieve that. For me, everything is achievable if you have the clear goals and if you have the right, other contributory or contextual factors to support you get there. So I say stand your ground. And that's an interesting one, because sometimes when you tell people what your plans are or your goals are, you might have people that think, oh, what are you talking about? How is this achievable? And I think for me, it's been important. And there are times that people probably have remarked, oh, it seems you do not know what you want, because I've always pretty much, as I said, stood on those connective points, or have had more than one thing going on, and it's almost felt like, oh, you don't actually know what you want, do you? But I've always been clear in my mind where I'm going with things. So I will maintain that position of not apologizing for really, doing lots of learning, gaining lots of skills and experience, and having a portfolio career, as it were. When I write my biography, I say, listen, I've got an eclectic background and I can do lots of things, and sometimes it doesn't feel right, or sometimes it doesn't feel that they connect. But believe you me, as you progress through your career and you start working in regional NHS organizations, national NHS organizations, it does make sense. All of a sudden, you are not just a clinician, because as a program lead or head of a program, you're going to have management skills. You're going to have the little finance in there. You're going to have the planning skills. So it all comes together in the end, depending on what the long-term goal is. Now, taking opportunities along the way, again, I have said, there are times that you will find the opportunities. There are times that people will find you and offer you opportunities. Take them. Sometimes it might feel, oh, why would I do this? As long as you can see the benefits to the long-term goal, or if nothing at all, the fact that you can identify some transferable skills from those opportunities, I will take them. Sometimes I have sought opportunities for a number of reasons. And again, something I don't apologize for is sometimes there are opportunities that you want to get in, certainly in the technological world. Sometimes you're thinking, oh, there's that opportunity. Can I access it? I've always worked on the premise of actually, if it is an opportunity, so in the technology world, lots of men in the technology world. And so when the opportunity is there, I'm thinking, oh, I am a woman and I am a Black woman. So potentially this is an opportunity that, you know, would make a difference, not just for me, but for people that look like me, because then I can say to people, or I can show people that this is achievable. So I will take such an opportunity. So for me, sometimes it's about, you know, does this benefit me and does it benefit my wider, colleagues or friends or whatever? So it's about, you know, what motivates you and what your agenda is. I say find the right mentors. So I will add on to that as well, coaches. So mentoring and coaching, they're different things. They complement each other, but they're different things. And I have got both. So my coach is the one that challenges me and says, so Henrietta, why are you accepting this? This is unacceptable. What are you going to do about it? How are you going to address this? So Henrietta, you want to go into senior leadership and yet you do not want to use management language. How is that going to happen? People take you seriously when you speak like them. So whilst I appreciate that you want to stay you, it is important to realize how the system works. So I've got a coach that does that. You have a mentor that really promotes you, the person that opens the door, the person that advocates for you in those meetings where he says, oh yeah, but I do know this woman who can do the job, or I think she is good, or I think that. So you need both really in terms of making it happen, because you need the people that open those doors for you, but you also need the people that challenge you to move your position or not maintain the status quo. The final point, or the last but one point for me, is about knowing your value and values. For me, they're two separate things, or they are different. Whilst complementary, they are different. So knowing your value, I have through my career gotten to some points where people have offered me things and I've said, you know what, actually, I think I am better than this. So no, I will not do it. And it's very much been looked at as, oh my goodness, this is such a good opportunity. Why is she saying no to it? It's because I know my value, and I do know that actually I am being offered something less than I am worth. And I am not prepared to do that for two reasons. A, because I will burn out really quickly and I will probably become resentful, because knowing that I am better than something, but I'm being offered it and taking it and probably working in an area and seeing other people who might not be doing similar things, but probably, you know, in a higher position, might not necessarily work for my own mental health and well-being. So no, if you know your value and you are able to communicate that very clearly, respectfully, then people will respond to that. Because if you do not know your value, other people will not. Now, the values thing is so important, because as a person, I have got certain principles that I abide by. And I've always said to people that, you know what, I've built my whole career on a reputation, and there are things that I will not do. For example, I will never compromise my personal or professional integrity. So however tough things get, however hard things get, I always stay professional. I always stay respectful to others, however difficult. And I can tell you for a fact, 17 years in the NHS and in health careers, I have come up against a lot of barriers, a lot of boundaries, a lot of difficult times. But what for me has been so reassuring is, and through feedback, so I don't know if anybody has done a 360 feedback. So as part of my Darcy Fellowship, as a leadership program, it was very much around how are you able to give feedback, and how are you able to receive feedback as a developing leader? So anybody in medicine or in other healthcare professional training will probably do a 360 if you haven't already done one. And you usually send form to colleagues and they say things about you. For this one, we actually had to sit in front of, you know, the person that was giving us the feedback to get the feedback. And it was part of that development. When I did it, I chose 3 people, and actually 4. So I chose 4 people, a manager that I, you know, in the end, at the end of that career, at the end of that particular career, we hadn't quite gotten on very well. I chose somebody that I knew for a fact didn't like me for whatever reason I did not know. And I chose somebody I had managed, and I chose a fourth junior colleague who I thought was quite opinionated and will say things as is. Now, when I did that 360, I think for me, at the end of it, everybody had some views about why things were the way they were. But fundamentally, I left all 4 meetings with a common theme, which is very much, if something needs to happen, you can make it happen, or you will make it happen. And the fact that even though you've had different roles over the years, junior, senior, you have remained you, and you have been an inclusive leader. For me, it just meant that I have managed to live my values. And it is so important. And as I came into much more senior roles, some of the questions that some senior colleagues asked me is, Henrietta, when you enter a room and you leave, what is the Henrietta brand? What do you want people to associate you with? And that really is something that has stayed with me. And I think it's so important as we go through things and making things happen, is holding on to those values, because the NHS, whilst it's big and has over 1.3 million staff, as you go higher up, it becomes such a small world. So you will be hearing from other speakers after me. I do know at least 2 of the 3 speakers that are after me, because that world becomes smaller and smaller. So I think it's important to know your value, but more importantly, hold on to your values. And you will see at the bottom that I've put on there, relationships, relationships, relationships. From the top, right from your hard skills to knowing your values, the one thing that threads through all of that is your ability to A, maintain relationships, B, form them, form them, maintain them, and use them. So the 3, for me, the critical thing important to everything we do is relationships. So again, it's about how you form those relationships, how you take opportunities to form them. Thankfully, we've got social media, we've got our LinkedIn, we've got our Twitter, we've got all sorts of social media opportunities to connect with people. More often than not, there are lots of senior people out there who are more than pleased to be contacted by somebody who is saying, listen, I've been following your career, and would it be okay to connect with you either for some mentoring, for some advice? A lot of people are more than happy to do that. So find opportunities to, form those relationships. And when you have formed them, maintain them. And it might be that every now and again you send people an email to say, oh, or a text or something to say, oh, haven't been in touch for a while, how are things going? People hold you in mind, and that's where sometimes opportunities come from. But also, how are you using these relationships? It's not so much about always, we all have relationships in our day-to-day lives. And I think sometimes it's important not just to take from relationships, but also think about how you can give back to that relationship. So the 3rd relationship point for me is about how we give and take in those relationships, because when you do that, you get a lot more out of it. So that's me. I think I have been speaking at you for a while, and I am now going to open it up for any conversations, any discussions, or any thoughts.
That was really great, and thank you for that. I think it's really important what you said about kind of taking chances, but don't overburden yourself, and as well, like with networking is really important. We have one question from Armita, which says, how do you think undergraduate training can line up with the HE digital competencies?
Oh, very good, very good question. So it just happens that I am the person that actually sits in both camps in terms of the HE digital competencies. So there are a number of significant pieces of work that's currently going on. So with the digital competencies framework, we have developed a self-assessment diagnostic tool that allows individuals, either at undergraduate level or postgraduate level, to be able to assess their own digital skills and then be directed to relevant learning to build those skills. Now, as part of that roadmap, what we are looking to do is, whilst we've got a generic tool that any of our, 3.1 million health and care staff can use, we are very much cognizant of the fact that digital, it is sometimes contextual. I mean, it's contextual specific. So as part of our roadmap for the next, couple of years, we will be looking at building a profession-specific competency tools, which is also interactive and is very much overlaying our digital capabilities framework. Though that pieces of work have started. So the psychological therapy workforce have already outlined their digital competencies based on the career framework. We've got another piece of work going on by one of the Topol digital fellows looking at AHPs. But more importantly, as the head of blended learning, what we are beginning to do, and we've recently commissioned 7 universities to provide that training, we are actually putting this into effect by asking all these commissioned university training courses to identify how they do a baseline assessment and be able to incorporate digital competencies and skills into the curriculum, so that by the end of the 3-5 year or however long the training is, we have a digitally capable and competent staff. Does that answer your question?
Really good. I've got a question actually. Do you have any idea how we can kind of try to ensure that digital health and things like machine learning don't kind of mirror our own biases in healthcare, like with kind of ethnicity and that kind of thing?
Oh, I'm going to go on mute and see if the question gets better. Can you please ask the question again?
So I was wondering how, with things like AI kind of coming through right now and a lot of digital health, how can we ensure that these don't mirror our own biases in healthcare? With things like race and that kind of thing, how do we ensure that that doesn't translate into digital tools?
Really, really interesting question. And as I said earlier, I mean, the rate of change in terms of our technology and digital world is significant. And our ability to adapt to it is not quite as fast as, the rate in which these digital technologies are coming in. I think fundamentally for me is about 3 things. When it comes to the world of digital, we need to think about the people. So have people who are using these digital technologies to provide digital healthcare. Are they capable? So it's not so much even about just the capability, but it's about the attitudes as well. And you've rightly pointed out that how do we ensure that we're not reinforcing biases? We're not, widening the digital divide gap or inequalities further. That comes in with developing those capabilities, understanding how some of these technologies work. So, I mean, as I highlighted, I am developing an AI tool. And for me, it was very much my knowledge of the AI world tells me that actually most of the tools that we have at the moment is biased. It hasn't looked at gender, it hasn't looked at, ethnicity and incorporating such data. So the knowledge then allows us as clinicians to be able to start asking these questions. Also, it is about the process. So what processes are we going through to ensure that we're utilizing these digital tools well? And some of it comes down to choice. So whilst digital is here and we're encouraging people to use it, we have to appreciate as well that it's not always effective for everybody. So it's being able to make those decisions. And then finally, it's about the technology. If you've got the right technology, but in the wrong hands, or the wrong technology in the right hands, you do not get the outcomes that you need to get out of it. So I think for me, it's 3 things: people, process, and the technology.
That our reliance on kind of data from the UK, which is obviously a kind of white dominant population, is what influences our biases in things like AI. Do you think if we use more of the global data set?
So again, interesting point, Alex. I think we rely on, actually in a number of ways, or in our world, NHS as an organization has one of the richest data sets that anybody could find. I mean, if you think about the people that are accessing the NHS, gosh, talk about, there is a variance in gender, in ethnicity, in age. So the diversity is significant. So I think even by using, and I know that, sometimes the world out there is actually jealous of the data that the NHS sits on. If you look at places like the Turing Institute, they're doing some phenomenal pieces of work using data from England or using the NHS data. And I think it is about who is doing what. And it is about how we utilize the opportunities we've got. As I've always said, it's about opportunities. So I can go and use the data. It's the choices I make. It's not so much the data not being available or not being used. It's the choices I make as an innovator or as a researcher in terms of what I choose to do to be able to use that data. And for example, I have chosen to, use data that really reflects the needs of ethnic minorities. And that's a choice that I have made. I could have trained, or we could have decided to train these algorithms using generic data. But for me, it's about how do we begin to disrupt the market and start bringing in or building tools that takes into account diversity.
Great. Well, thank you. We have a question from Hannah as well. She's asking about changing careers and looking into midwifery. She's asking where you would recommend starting and what support is there for changing careers.
Okay, so I'm reading Hannah's question, and it says also, do you think you need confidence to start? So yes, Hannah, definitely, I'm not sure what your background is, and happy to have a detailed conversation about it. But your first point of call is the NHS. If you even Google NHS Careers, it will take you to the NHS Careers website. It will give you all the options there are. And if you are specifically looking at midwifery, it will give you information about midwifery, what you need in terms of your prerequisite skills, knowledge, and experience to be able to get into it and be able to take it up from there. The world, as I said, is opening up in terms of healthcare careers and in terms of the way to access these careers. And as we carry on developing the blended learning approaches, as you look at it now, and if you haven't got the prerequisite requirement to go straight into midwifery, there are always other opportunities or pipeline training opportunities to get you there. So have a look initially. And if you do have any specific questions, definitely come back to, if you search my name, I'll come up in so many places. Definitely get in touch and I will connect you with the right people.
So Amit has also asked about doing integrated degrees in terms of kind of portfolio careers and things like biomedical engineering and machine learning.
Is it important nowadays? So I tell you what, my strategy throughout my career has been thinking about how the world is changing. So I'll give you an example. When I finished my diploma in nursing, I said to everybody around me, because of the way the world is changing, diploma will not be relevant in the next 5 or in the next however many years. And everybody thought to me, oh, this is this ambitious woman again. But I tell you what, in 5 years after we qualified, nursing has become an old degree program in England or in the UK. So I think, again, as I said, it's a very much a long game. I know a medic who, after their BSc, took a year out, has done a different course. I think it was a public health master's or something, and is going to go back into their medical degree. If you have got an opportunity to do an intercalated degree, go for it. If you've got the capacity, the means and things to do it. Or even if you don't see how you're using it now, always put it in your back pocket, and believe you me, it does come in handy.
Sam Shah for the next panel has numerous different degrees in law, in finance experience, you've got a degree in dentistry. So I think about, again, taking the chances where you see them and kind of being flexible with your career. So there's also a question from Ered about, he's done a BSc in engineering. And he's asked about switching to a career in project management in healthcare.
So if you've done an engineering degree, the best healthcare professional area to look at would be your healthcare science. So again, it's an area where, people with certain, backgrounds, including engineering, almost always could pick up a career there. The way that I see it is very much thinking about, so engineering, it's about designing things. It's about all of those things. And how can we bring that into healthcare? I can tell you for a fact, and as part of our digital readiness program, we are beginning to look at what the future holds in terms of digital skills. And somebody with an engineering background would potentially become somebody that we would rely on in terms of supporting us with some technical skills. For example, when we did the TOEFL review, some of the co-chairs or the experts who were on that review were engineers. I can mention two at least. So we had Professor Mbeah-Bankas from, at the time she was in Oxford, but she's now in Cambridge, with an engineering background, but currently doing some fantastic modeling work in health. So she's looking at, she was doing a piece of work not that long ago around how we can predict the use of intensive care beds during COVID. We had what's his name now, Professor Lionel Tarasenko, who is also from Oxford, and even though has an engineering background, does all this work around developing, digital technologies for diabetic care. So I think, you've got an engineering background, but there's definitely a place for you to, to come into a health career. Look at your healthcare science courses. Again, Health Careers website will give you some information around that, or go straight to the School of Healthcare Science.
Okay, so the question from Amita again, asking about work-life balance. So is it entirely clinical?
So work-life balance, I see this question in a number of ways. So the question has a following on question that says, is it clinical or entirely policy-based? So I'll tell you something, work-life balance. So I'll take the first part in terms of the split, in terms of my working life. And I am somebody that gets bored really quickly. and anybody that knows me, I call it excitement in my life. So I am not somebody that can just switch my brain to one thing and it's one thing only. So I like the blend of either having a clinical post and then being able to do other things, either research, other policy or whatever. That's how I function best. And that's how I keep on top of things. Having said that, what is my work-life balance? As in, I'm doing quite a number of things all the time. How do I maintain my health and well-being? And how do I stay on top of things and be as effective as I can be? I can tell you for a fact, I've been in the NHS for 17 years. I've had just 1 day off sick, 1 day. How do I do that? Certainly, 5 ways to well-being. I'm always connecting with people. I am a people's person. I love to, sit and chat, do things, and I do it both inside and outside of work. So sometimes you have an hour's meeting. It doesn't hurt to take the first 5 minutes to actually get to know the person or speak about life. So I do that. I also do so many other things. And I just put it out there as well. I am somebody with a religious background or faith. So if everything else falls, everything becomes difficult around me, I go to base. I have a strong supportive network in terms of family and friends. So I utilize all of those. And I always joke with anybody that knows me that when I have got big pieces of work, I use all my lifelines. I phone a friend, I use 50-50, and I will use all my lifelines basically. So that's how I maintain work-life balance. And I have some core principles in there. As a parent, I've always said, whatever I am doing, if at any point I see any indication that my children are suffering as a result of that, I will stop. And I am pleased to see that it hasn't impacted on my family life. And as the evidence suggests, contrary to what lots of people say, children who have, strong role models or working parents end up becoming, working adults themselves. So that's how I maintain it.
I think it's like you said earlier about taking chances but not kind of taking ones that don't value yourself, or I think what the doctors take in too many different jobs and over kind of burden themselves and burn out quite quickly. So that's important too, I think.
It is. Just to add, Alex, as well, which is why it's important to make those choices. So I'll give you an example. I remember somebody approaching me and says, "Oh, Henrietta, I've got a job that I really want you to come and do." And I'm going, "No, actually, I'm in a program that finishes probably in 6 months' time." And she says, "Oh, I'll wait." And I was quite shocked. I thought, "Oh, why would you wait for me for 6 months?" And the response was very much, you are a woman, you're from an ethnic minority background, and yet you seem to have achieved so much. And that tells me two things: that A, excuse my French, you've got balls, and B, you make things happen. Okay. Now it was very complimentary, and I took that as it was humbling as well. But equally, I thought, does this actually fit with my agenda? Is it something that I am passionate about? And the answer was no and no. So I said, you know what, whilst this is great and very complimentary and humbling, actually, it doesn't fit with my biggest agenda. And I haven't got that passion. For me, I do not take on any role that I haven't got the passion for, because it does get hard. It's not always exciting. And the only way that you can keep going is if you genuinely have a passion for something. When it gets hard, you are in a position to carry on.
Yeah, I also got a question about, in terms of the kind of relationships you build and making it a two-way street and giving back. How do you do that at in your career?
So I'll give you an example. So as a clinical entrepreneur, I've got a mentor from a commercial background who understands how to commercialize product and how to, understand how to utilize the commercial language and all of that. But is somebody that doesn't quite understand or is connected to the NHS landscape as much as he would like to. So what do? I connect him with people within the NHS landscape. I get my mentoring from him, steering me or shaping my business or commercial thinking. As far as I'm concerned, it's a win-win. So sometimes it might just be that in a health career or in other careers that you have done. So we've got engineers on here, we've got people connected to so many other things. And sometimes it might just be that the person that's mentoring you just needs to understand something. So your knowledge of something or your connections with others sometimes might just be enough. So for me, it's the little things we're giving back. Because remember, as a mental health nurse, I'm always cognizant around the fact that 5 ways to well-being. Giving is one of the 5 ways to well-being. And when we give our time and support to others, it supports our health and well-being. So it's not always monetary or time in terms of giving. It's different ways. So it's finding those little things. It doesn't have to be big.
Thank you. Are there any more questions from the attendees?
So I've seen one from Alicia. Best route to get into midwifery starting from GCSE. Good question. So starting from GCSEs, there are some courses in some further education colleges. So check your colleges. Some do what do you call it? Pre-registry. What are they called? Preparation for nursing, or that there are different courses that really that's the word. So access to nursing or midwifery and other courses are preparatory courses or pipeline courses that gets you onto nursing or midwifery if you haven't got the prerequisite requirements. So look at those, check access to nursing courses, or in some colleges, they do health and social care courses at college level to prepare you to take on degree programs. So have a look at those. Also have a look at Open University programs as well. So Open University, as we all know it, provides access to degree level courses to people who wouldn't normally have the typical prerequisite, as in A levels and the rest. So there are real opportunities to get onto midwifery program.
Great, thank you for that. Are there any more from the? There you go. One from Anita.
So Yeah, the Darcy Fellowship, as I said earlier, it is the one thing that saved my career in the NHS, because at the time I was going to go and bake cakes, which is my other love. But no, Amita, please don't feel sorry to have so many questions. That's why I am here, and I hope that it's helping. The responses you're getting is helping in some way. But for me, it's very much around the Darcy Fellowship is one that I have done 2 fellowships, by the way, but the Darcy one for me had it all. So the fellowship had a training component to it. So at the end of the 1-year fellowship, I got a postgraduate certificate in leadership in health. And at the time, the program was connected to Leeds University. Now it is connected to South Bank University, but you still get the same qualification out of it. So there was the academic component, which for me was great. If you put me in the classroom any day, anytime, I would say yes. So the other thing about the fellowship is it had coaching. And the coach that I had from the fellowship program is the person that I have maintained to date. And I did the program, 5-6 years ago. So the coaching element of it as well helped me shape who I am, because by the time I came out of practice, and when you are in practice and people just want you to do your day job, I felt like I couldn't speak up. I've as a child, I've always known that I am confident, but as I went into my nursing career over time, even though on one hand I still felt the confidence, on another hand, I didn't quite feel that I was able to be who I was. So what the fellowship did for me was to bring me back out. And I remember my mentor through the fellowship program saying, Henrietta, this is your opportunity to be who you are or who you want to be in terms of your next career. And he also said to me, I have noticed that you tend to keep your head down. And I'm quite surprised for somebody who is A, well-educated, and B, have sensible contribution to make. You need to start speaking up. And the third advice was start taking ownership. Okay, start taking ownership. So I did those 3 things. And what he also did beautifully for me was to start mirroring the way that I needed to be. So instead of sitting at meetings like that, he would sit across me, and as soon as he saw me going down, go. So I kept doing that. And now I can sit in meetings, take ownership, and feel that it is okay. So the Darcy for me was a program that had lots of facets to it that really helped me get the whole picture and be able to understand the wider system and be able to progress with my career.
2 questions. We've got Laura asking about advice in mental health. Anita's asked about advice for working as an audiologist. And so I was asked about advice for enterprise and health.
Okay, so I've got 3 minutes to answer those. Working in mental health, I think for me is been fairly simple. When I started my training, the first thing one of the lecturers said is, when you bring yourself to work, and mental health is about the use of yourself. As I've said, relationships is key to everything, but equally, as you use yourself, you need to take care of yourself. So working in mental health is a balance between using yourself and taking care of yourself. So you go into that area, gosh, it opens so much doors. And I think for me, it has been a privilege to be able to work with people at their most vulnerable point and see them the other end. But equally, what I will do sometimes is, as I walk through the front door of a ward or a unit, I leave things behind. Okay, I leave things behind because that's how I maintain my own health and well-being. And I come next day and I carry on. So that would be my quickest and shortest advice to you working in mental health. The other question was about, what was it? Do you have any advice for? So in terms of, so there's something about audiology, there's something about paramedic science, lots of opportunities coming up. I certainly did, what do you call it, the Darcy Fellow with an audiologist who, as a result of that, is doing some national work at the moment. So again, allied health professionals, lots of opportunities coming up, or currently there are some opportunities there. I'm not able to go in so much detail because I'm looking at the time. If there are specific questions, I am on Twitter, which is at Mbeah_Bankas. Follow me, I'll follow you back. Let's send me some direct messages. I'll send you some responses back. because there are lots of questions coming up now, which I am not able to answer because it's 30 past. It's been a great pleasure having these conversations with yourself. As I said, I am on social media. I am on LinkedIn. If there are specific questions that you haven't been able to ask, please send them, and happy to carry on the conversation.
That was great. I'll post those links in the chat for people to use, and that was really great. So thank you for that.
Okay. All right, so I've just put my Twitter handle in there. Thank you all.